Welcome once again to ASA TV. I'm Ed Highland, and I'm joined now by Dr. Jim Grant. The subject is leadership, and Jim, thanks for joining us. First of all, give us some thoughts as to why ASA is really focusing on leadership as a core need or goal for its members.
Well, there's a few reasons, Ed, and one of those, physicians really are natural leaders. And it's in our DNA, anesthesiologists in particular. And what we're doing is we've gone throughout the country and we've talked to anesthesiologists about issues that are important to them. Leadership development was really rising to the top. So we're going to look to develop new programs, to really identify future leaders, because it's important that anesthesiologists are not, we're always naturally going to be a chief of anesthesiology. But to be in the corporate suite, to be in the dean's office, to be in the regulatory agencies, to serve in legislatures. Anesthesiologists really understand the whole healthcare system, and really the more we can get out, probably the greater impact we can have.
Why are physician anesthesiologists uniquely qualified really to be the specialty for healthcare leadership?
If you look at anesthesiologists, 30 years ago, anesthesiologists were just in operating rooms. We hit so many parts of the healthcare system now, intensive care medicine, pain medicine. We do so many things outside of operating rooms today. We really are able to touch the patient throughout their entire experience.
Give some thoughts with the new strategic plan as to how ASA is kind of positioning to make sure its members are indeed healthcare leaders.
What we're doing is we're taking a look. Originally we didn't have a pillar on healthcare leadership. So what we've done is we're beginning to look at programs. We have a program at Northwestern to develop leadership skills. We're beginning to explore some others. We're identifying throughout the country who are our potential leaders in the future.
Dr. Grant, if you would, give us some thoughts. Healthcare leadership, could be perhaps better defined in some ways. Can you give us some thoughts of what healthcare leadership means to you? What does someone need to do to be a leader in healthcare?
It's an ability to work, to be a consensus builder, to be a good communicator, to be articulate, to understand what will make the whole system work better for patients.
It's all about leadership. Dr. Jim Grant, thank you so much for joining us.
Thank you.
And this is ASA TV.